we are talking about chiropractic. So chiropractic, where is it? Right here? There it is. So chiropractic care is a service, a professional service that a lot of pregnant families will utilize as they prepare for labor and birth. And you might be asking the question, should I see a chiropractor in pregnancy? And so that's what I would love to talk about today. Now, the benefits, there are some real benefits to seeing a chiropractor during your pregnancy. And one of the first ones is that chiropractors can help with low back pain. So low back pain is something that a lot of pregnant women experience. The additional weight, all up front, pulling on their back, and just having such a different experience with movement when you're pregnant can really put some strain on your lower back. And many people have found that with chiropractic care, they can do an adjustment on the lower back, and that can find some relief from that problem. Now, chiropractors during pregnancy can also help with other issues that might pop up if you're having, say, carpal tunnel. That is a somewhat common problem in pregnancy, and just some additional swellings, either that be from a carpal tunnel or swelling around the rib cage. Different swelling can be helped with a chiropractic adjustment or by seeing a chiropractor. The other thing that chiropractic care can help with is aligning the pelvis for birth. And I'm going to pull my pelvis. If you've watched any of these videos before, you might have seen this handy dandy childbirth education tool, which is my fake pelvis. And the pelvis, it plays such a crucial role in birth because the baby has to descend through the pelvis, and it's a tight fit, and it requires a pelvis that is very flexible and has a lot of movement to it. And chiropractors, when you get adjustments, they can work on adjusting your pelvis and the ligaments around your pelvis and your sacrum and your uterus to help really prepare your pelvis for labor and birth. One other thing that a lot of people will see a chiropractor in pregnancy if they have a baby that is presenting breech. So if we have a baby that is not head down, one of the ways to encourage a baby to turn is through something that the chiropractor can do, which is called the Webster's technique. And Webster's technique is a way to work on the ligaments between the sacrum and the uterus to help open up the room in there and allow the baby to turn. And the Webster's technique is something that not all chiropractors do on a regular basis. So if you are interested in going to see a chiropractor to help facilitate a breech baby turning to a head down vertex baby, make sure that you can find a chiropractor that is very skilled in this technique. And one of the easy ways is to ask a local childbirth educator or doula if they have any recommendations or know of any chiropractors in the area that are skilled in that technique. So turning a breech baby vertex is another great reason to go to a chiropractor in pregnancy. Now, you might be wondering if any of this is research-based. So the good news is that research does suggest that chiropractic care can shorten the length of labor, which is pretty exciting. It can reduce the likelihood of meconium being in the amniotic fluid. So that's when the baby passes their first bowel movement in the womb. That's called meconium. Research has suggested that it reduces the risk of preterm birth, the use of forceps, and cesarean as well. So chiropractic care is an alternative service that you can go to anytime during pregnancy, and then for that Webster's technique, it's usually about 8 months on when that's done in real purposeful for turning the baby. And I mean, one question you might ask is whether your insurance covers chiropractic care. So it's definitely something to talk to your healthcare provider about, talk to your insurance company about, just to find out if insurance is covered or if you have to pay out of pocket for that service. So something to think about as you are preparing for labor and birth. I definitely think that chiropractic care is underutilized, and that I have seen so many great benefits when clients get chiropractic care on a regular basis. So I think it's something to think about. Okay, today's a good one. We are talking about meconium. So if you have not been following the Big Wheel of Birth series, you might not know that the first spin ever was about poop. So we are coming around again to talk about poop, but this is different. So meconium is actually a baby's first poop, a baby's first bowel movement. And there's a couple things to know, and that the reason people might talk about meconium and some concerns about meconium. So when it can be a concern is if the baby has their first bowel movement, their first poop, while they are still inside. So inside the uterus, they're still inside, they haven't been born yet, and they poop. Now, there's a couple reasons that babies do this that we think. One, sometimes we see that when you go past your due date a few days or a week or more, then sometimes there is it can be more likely that the baby will have their first bowel movement inside the womb. So that might be one reason. The second reason that we think is that if the baby is stressed inside, that will cause them to have a bowel movement. So if you have watched the Breaking the Water video, so right here, it looks like this, and I'll put a link down below. In that video, we talk about when your water breaks, if there is a color to it, and it's not just a clear color or have any pinkish or mucusiness in it, if it has a brownish tinge, a greenish tinge, what that means is that the baby has passed their first bowel movement, and that is meconium in the amniotic fluid. And in this case, most care providers want baby to be monitored to make sure that the baby still isn't stressed and isn't continuing to be stressed inside the womb. So it is a standard practice for most care providers to ask you to come in to the hospital or to the birth center to be monitored if there is meconium in the fluid. Now, speaking of birth centers, sometimes in labor, some birth centers have policies that if there is meconium present, that you will need to be transferred to a hospital prior to birth, as long as there's time for that. So I know that I have worked with some birth centers in the past that is their policy, that if there is meconium present and that they know, then it is an automatic transfer to a hospital. And the reason for that being the hospital will have a higher level of specialty training for nurses and equipment in case there is something concerning about the baby after the baby is born. So that is not all birth centers' policies, that is just some. But that being said, meconium sometimes can be a concern. It can be something that might require a little bit extra monitoring. Some hospitals might have policies if there is meconium regarding how much monitoring is done in labor, whether intermittent monitoring is allowed or continuous monitoring is recommended. The other thing that can be a little bit different is at the time of birth of the baby, with confirmed meconium. Oftentimes the hospital policy is to cut the cord fairly quickly, like not to do a delayed clamping, and for the baby to receive some extra oxygen and just to be checked out at the baby warmer in the room instead of going straight to mom's chest. So now this does depend on hospital policy and care providers. So it is something, so you can always ask your hospital what the policy is about meconium, or have that conversation with your care provider, just so that you know. I know that I have seen that sometimes the policy depends on the thickness of the meconium in the water, which it can vary anything from just a light tint, just lightly tinged with a brown or speckled with a brown or a green, to something really thick, which is more of like a pea soup look and consistency. And definitely the thicker, darker consistency is more concerning, and something that definitely would need to be monitored more closely. And the baby would need to be monitored. I mean, the baby would need to have some special care when they are born. And the main thing that we don't want to happen with the baby is for them to inhale any of that meconium. It can cause babies to be very sick, and it's something that we want to make sure that does not happen at the birth or shortly after the birth. So there's usually that concern, and they need to make sure that doesn't happen. So meconium, while it is very natural, if it is thick and passes in the womb, it can be something concerning that needs to be monitored and taken care of properly. Now, the other thing about meconium is the baby's first stool. If it's not passed in the womb, the baby's first poop, the baby's first bowel movement that happens when you are at the hospital is going to be sometimes alarming to new parents. It is usually very dark, very sticky, very tar-like, and sometimes hard to even clean off a baby's bottom. So don't be surprised if that is the consistency that you see with your newborn baby. That is very normal, and it will change as the baby eats and gets, starts intaking fluids and breast milk, and that will change. But in the beginning, it is very thick. Now, one little tip that I got from a midwife friend of mine to prevent that stickiness is that if you have any oil, like a coconut oil or a sweet almond oil, that you rub on your baby's bum when they are just born, when that meconium comes out, it will be easier to just wipe off. So, little midwife trick that I'll just pass along to you. So meconium happens, but sometimes it can be concerning. Okay, this one sometimes is controversial, so this is exciting. Today we are talking about natural childbirth. Now, controversial really isn't the word I'm looking for. Maybe confusing is the word. And the reason is the idea and the way it's talked about has changed over the years. And I use the term natural childbirth, and I've heard it used in many different ways. So let's talk about it a little bit. So what does it mean to have natural childbirth? So you're talking to someone at the store, you're at Target, and they say, "Oh, you're pregnant. Are you gonna have natural childbirth?" And you're like, "I don't know." And someone says, "Well, I had natural childbirth. I didn't have a C-section." Okay, so this is where the confusion comes into play. The term natural childbirth, I would say, for many, many, many years meant giving birth without the addition of pain medications, without being induced. So really low intervention would be traditionally what the term natural childbirth meant. So say somebody giving birth at home, someone giving birth at a birth center, where they're definitely not going to have an epidural, they're not going to have IV narcotics for pain management. That would be traditionally thought of as natural childbirth. They're using techniques like breathing techniques, position changes, visualizations, vocalization, all of that to deal with pain management. However, over the years, and I would say over maybe the last 5 to 10 years, I have seen the words natural childbirth actually mean vaginal birth. So I think maybe it's a little more acceptable for people to say I gave birth naturally instead of saying I gave birth vaginally, because, you know, vaginally sometimes people don't have the same comfort level of saying the word vaginal or vaginally. Of course, I have comfort in that because I say that word pretty much every day, but every other day maybe. But I think that has become what a lot of people talk about when they say they had natural childbirth. It really means that they had vaginal childbirth. So natural childbirth has changed over the years on the meaning, and it also sometimes is confusing as far as the way people think about their own birth and what they want to go through. And sometimes that natural birth, if you're a natural birther, that stereotype is somebody who, you know, is giving birth out in the wild and doesn't care about safety or something like that. What I've seen recently is people saying that they're interested in a birth that has no to low interventions. So interventions meaning some type of procedure or something done to augment labor, to start labor, to have an effect on labor that isn't just what the natural body is doing, what the body is doing naturally. So sometimes those are starting to kind of take the place of just saying that you're interested in natural childbirth. So today we got CERVIDIL. CERVIDIL is a medication that can be used for the induction of labor. Now, you might hear it called something else. The generic name is dinoprostone. I hope I said that right. It is a synthetic prostaglandin. So prostaglandins can help the cervix thin, so efface. So not necessarily open to dilate, but to efface. So if you've ever heard of people being recommended to have sex in order to induce labor or to soften the cervix, semen contains prostaglandins as well. So two different things that contain prostaglandins, CERVIDIL and semen. But today we're not talking about semen, we're talking about CERVIDIL. So CERVIDIL is a medication. The way that it's administered is, I like to describe it as kind of like a flat tampon. So it is inserted into the vagina, and the medication is on the end of what you could imagine is the flat tampon, and it is put right up against the cervix so that the medication can hopefully start thinning your cervix. So when it is commonly used for labor induction is if someone is needing to be induced and yet their cervix has not started thinning much or opening at all, then the protocol can be, some care providers suggest coming into the hospital the night before the labor induction is to start, the maybe Pitocin induction would start, coming in the night before and getting a dosage of CERVIDIL. So CERVIDIL is generally done overnight because it is something that some people can sleep through without too much discomfort. So generally you check into your hospital room, get situated, get settled in, be put on the monitors, go to the bathroom, be put on the monitors, and then the CERVIDIL is inserted right up against your cervix. So the reason for choosing CERVIDIL, going to CERVIDIL instead of straight to oxytocin or Pitocin, synthetic oxytocin, would be because your cervix might not be considered favorable for a Pitocin induction at this time, and with CERVIDIL it possibly could become more favorable. So what a lot of people experience when having CERVIDIL is either no feeling at all, no sensation, or maybe some mild crampiness and kind of that mild discomfort from crampiness. It's not common for CERVIDIL to cause full-on labor contractions. That is uncommon. However, there is a side effect and a risk of getting CERVIDIL, and that is for your uterus to become sensitive to it and to have very quick contractions that are not actually productive contractions that come on very strongly and quickly. And if that happens, generally what your care providers will do is to remove the cervidil so that it's no longer up against your cervix, and to calm that uterus down and bring down the contractions. So those quick, short contractions are not actually what we're looking for when they do a cervidil induction. That would be one of the side effects. Generally, cervidil stays in your vagina up against your cervix for a 12-hour dosage. So it's 12 hours and then it's removed by your care provider. And sometimes if there is no change, I've seen care providers suggest a second dose, so another 12 hours. Now you can, while you're there, some of the questions are, can I go to the bathroom when I have a cervidil? Yes, you can go to the bathroom. Generally the cervidil stays inserted even if you get up, walk around and go to the bathroom, though a lot of walking is not recommended because it would, make it more likely that the cervidil would come out. So my big recommendations for if you are getting a cervidil, if you are being induced with cervidil, is to set your expectations for what is going to happen. That likely there's not going to be a huge significant change in your cervix overnight, which is totally normal. If you're finding any kind of unusual side effects or discomfort, to alert your care team as soon as possible. You will be monitored, so they should have a heads up on it, but definitely alert your care team. And please make it your priority to sleep. Sleep is so important if you are at the beginning of an induction and you're starting off with cervidil, because it is likely going to be a long process, and sleep in the beginning is going to be so key. So setting up that room for sleep, having your support person really promote sleep. And what that means is, not a lot of chit chat, not a lot of watching TV or, any kind of distracting activities, usually just getting some sleep so that the cervidil can do its part and you can be ready for the next phase of labor and the next phase of the induction. And sleep is so important when it's paired with. Okay, I like this one. I do say that a lot. Today I'm talking about water birth. So I'd love to talk about, maybe some pros and cons of water birth. First, let's start with what water birth means and then talk about the pros and cons. So water birth means giving birth in the water. So meaning the baby is born, their entire body comes out in the water, and then they're lifted out of the water and put on mom's chest. So water birth is exactly what it means. Now, it's different from laboring in the water or using the tub or the shower. Those are great and make a lot of sense and great for labor, but this is the birthing in the water. So there are, first of all, let me just, before I hit pros and cons, I'd love to say that water birth is not available everywhere. So it's more common to find the option for water birth in a birth center or definitely a home birth. But there are some hospitals around the US, Canada, the UK that allow for birth in the water, but that would be more rare, but it can happen. So if you are interested in water birth, then definitely your first priority is to find a place to give birth that offers that. So it's not, I cannot believe I've had people in a class and I've talked about, okay, water birth might be an option where you're giving birth, and people say, that's what I really want. And I ask them where they're giving birth and I say, they don't offer it there. So you need to find out beforehand, because only certain places will allow for water birth. Now, a water birth can happen either in a inflatable tub or in a bathtub or a rigid tub, depending upon what is available at the place where you're giving birth, or if you're giving birth at home. It is important to have the water at a certain temperature so that baby is born into basically doesn't have much of a temperature difference between inside, where they were in a fluid-filled environment, to the outside. And your care provider is someone who will take care of that and make sure that's maintained. Now, Pros and cons of a water birth. First, let's start with the pros. So, water birth is something that, first of all, laboring in water is something that can take away the pain, really be a great strategy for pain reduction. And water birth, one of the pros is that you get that pain reduction all the way through the birth of the baby. So it's not something you have like through transition and then when it's time to push that you have to get out and birth the baby. That no, with water birth you can continue that pain management all the way through the birth of the baby. Now, another pro of water birth is that it reduces tearing of the perineum. So because of the pressure and the water and just the maybe increased ability for tissues to stretch, the water birth, women who give birth in the water have less tearing of the perineum, either experience no tearing or a smaller amount of tearing compared to people giving birth on the land. So that is a nice pro to water birth. One thing that I feel like isn't talked about a lot with water birth, but personally I had 2 of my 4 children in the water, that I found was a big pro was the privacy of water birth. So instead of a typical birth on a bed, a land birth on the bed, where everyone is pretty much, right there looking at your crotch as the baby comes out, a water birth has sort of that filtered view of what's going on, which can really lead to a feeling of privacy to the person giving birth and a feeling of a little bit more autonomy of birthing, I think, in the water than giving birth on the land is I believe. And finally, one of the pros of water birth is a decreased incidence of postpartum hemorrhage. So, an interesting benefit of a water birth. Now, cons of a water birth, I guess the first con is just to point out that it's not very available. So it's not an option that a lot of people have. So it is rare, but the umbilical cord snapping in the process of pulling baby out of the water, if there was a short cord, that is rare, but can be a complication, though usually has no impact on the baby, but can be a complication that happens with water birth. And then there is a slight increase in infection risk that a couple of studies have seen that might show an increase of infection. And then the last con is just maybe the unknown, because there haven't been a ton of research studies done on water birth and comparing water birth and land birth. So the unknown is possibly a con when you're trying to make a decision. Also, as they're studying the bacteria, the gut microbiome, and the exposure, the positive exposure of baby to the microbiome that they are exposed to on their way out, on their exit through the mom's vagina, the babies born in the water might not have the same exposure. And so that is still being studied. So we still don't know everything about that as well. So there are significant pros and just a few cons that we know of right now, though research is catching up to water birth, and it's not that available different places. But if it's something that is of interest to you, make sure that you look around to see what options you have in your area. I wrote red raspberry, but it's short. The long version is red raspberry leaf tea. So red raspberry leaf tea, unlike its name, tastes nothing like raspberries. It's actually a black tea. And it's a tea that is often suggested by care providers, midwives, doulas, childbirth educators, to have some very important and positive effects for pregnant people. And so let's talk about the benefits of red raspberry leaf tea. Drinking red raspberry leaf tea in later pregnancy has been shown to have some really positive effects on pregnancy, birth, and postpartum. One of the main ones I love to just start with is talking about toning the uterus. So the red raspberry leaf tea is supposed to strengthen the uterus And a strong uterus has a lot of good benefits to labor and birth and postpartum. First of all, labor can be quicker and contractions can be more effective when the uterus is toned. So that's one huge benefit. And then postpartum, if we have a toned uterus, it can lead to a decrease in postpartum hemorrhage, because after the baby is born, we want that uterus to really contract down and prevent any postpartum hemorrhage. So a strong toned uterus can be to a great benefit in that. Also, it can lead to a stronger amniotic sac, and a stronger amniotic sac can lead to less of an incidence of premature rupture of membranes, where the membranes rupture before labor starts, which can lead to some complications of pregnancy. So a nice strong amniotic sac is usually a very positive thing. Toning that uterine muscle can also result in contractions that are less painful. So contractions that are shorter and more effective can possibly decrease the amount of pain that is experienced. The other thing that definitely midwives have recommended drinking red raspberry leaf tea because of its vitamins and minerals that are in the tea, and can almost serve as a great drink for labor, like an electrolyte, a labor aid, and can be a great drink to have and prepare when your contractions start as well. So when to drink the tea, how much to drink the tea, the first thing I would do is consult with your care provider. So ask them about drinking red raspberry leaf tea to make sure it's okay. But generally what we see is people starting out with about a cup, making sure that they're not seeing any kind of adverse effects, any impact, any uterine contractions or anything. After that, increase it to 2 cups a day, and can even increase more as you go later into pregnancy or even the last couple weeks of pregnancy as well. So it is something that can be really beneficial for labor, strong uterine muscles,